operated. But as you can see, Tel Aviv is very into healthy food, and we are already 3 years operating the B'tei Avon program, which is a long-term holistic approach program. I'm sure that you are going to hear more about it in the next 2 days. And we hope that many other cities will follow us, and the fact that this morning 4 other Israeli cities signed the pact means that our program and our municipal message of the importance of healthy food is delivered. So thank you very much, and enjoy the rest of the convention.
That was wonderful, thank you. Our next guest is our keynote speaker, and for a good reason. He flew in and has to fly out quickly from Geneva because he is the director from the World Health Organization, WHO, in the Department of Nutrition for Health and Development. And he's going to talk about improving the food environment for better nutrition, how cities can lead the progress of the decades of action on nutrition. Dr. Branca?
Good afternoon, ladies and gentlemen. Thank you, Lisa. Thank you very much for this very welcome invitation. I'm very pleased to be in Tel Aviv. It's actually my first time in Israel, so I'm very privileged to be there. What I would like to do with you is to, first of all, remind you that unhealthy diet and poor nutrition are among the top factors for the burden of disease. So you see here the list of the causes of deaths for all diseases in the world, and you see that unhealthy diet comes second. And then if you look further down, on the 6th place, you have overweight. And if you look further down, on the 9th place, you have maternal and child malnutrition, including insufficient or inadequate breastfeeding. So what we're dealing with today is really a critical agenda for health and development. What's special about urban diets? We have seen that in urban population, we tend to have an unhealthy diet. So more calories, more processed food, but also we have more opportunities to get a better healthy diet because, for example, we have greater access to fruit and vegetables. You have street foods, which can be convenient. So there are opportunities and challenges, but certainly the main challenge is the fact there are big discrepancies between different socioeconomic groups. If you're wealthy, you can afford a healthy diet. If you're not, then it's quite likely that you're not able to afford a healthy diet. And then you're going to have suffer all the consequences of an unhealthy diet. So there's a special challenge to the urban poor. Access to cash is regulating the quality of your diet. And we have seen that people with lower income tend to spend a lot of their income on food. So that takes away, clearly, the money from other services, from education, from clothing, from culture, from other opportunities of development. The informal sector is important, both as a source of income, because many people work in the informal sector, and as an opportunity to consume food. So what can we do about it? You have heard, you will hear a lot of good examples of solutions, but I've tried to give you a menu of the important options that you can have access to. First of all, perhaps an important concept is that the food environment is really critical. Yes, it's about people's choices, but people's choices are very much dictated by the environment. And, you know, the environment can have, on the one hand, lack of food. So what has been defined a food desert. Or sometimes you can have too much of certain foods, maybe of not the healthy choices, and these are what we call the food swarms. So we should avoid both the food deserts and the food swarms. I understand this may be a category which is perhaps more common in certain countries in the world. Certainly this concept has been invented in the United States, where this big problem of the deserts and swarms has been first observed. But it's an increasing problem everywhere else in the world. So what can be done to improve the food environment and to avoid that we go into this situation of deserts and swamps? Number one, zoning policies. Cities have a power to decide the design of the cities. And there are a number of experiences about zoning policies which may designate certain spaces for shops, for example, food outlets, markets. So it's designing the space. But it's also the possibility to limit the commercial food retail. I mean, a bit like you have with pharmacies, for example. You have a certain number of outlets per population. You can create incentives for businesses to be established in areas where the offer of food is not adequate. And so there is a possibility to work both through investment and regulation to decide what is the location and the density of outlets. And this map is the map of the food desert in the US. You know, there are ways to do that. There are actually very interesting indicators. In San Francisco, they've developed a food environment, a retail index. So it's possible to understand both in terms of food security and in terms of the nature of the establishment, what this environment looks like. Number two, food supply. Well, our cities are made of buildings, but they also have spaces that can be used for urban agriculture. You've seen here some interesting technological solutions. You can have vertical gardens. You can have fruit gardens on terraces. These are examples from New Mexico, for example. Yes, you're not going to live out of that production. You know, in many cases, it's about 5–10% of the consumption of food, but still, it's an important component for dietary diversity. Several studies indicate that where you have urban agriculture, the quality of the diet is overall better. But it's also a way to improve food education. As a mother, I'm sure you've experienced that children like to grow their own food and to play with their own food. They become familiar with that food, and that will be another incentive to consume it. Number three, well, it's not only about the food which is produced in the city. That's a small amount. Majority comes from outside. But the shorter those chains, the cheaper that food will be. And also there will be a promotion of the link with the surrounding area. So the reconnection of the city to its surrounding region is going to be particularly important to improve the food supply from the economic, environmental, and health point of view. And there are interesting schemes in different parts of the world. Some of them you can see also in the Milan Urban Food Policy website. Food which is often delivered at home, and this can be, for example, something important for elderly people who may have reduced mobility. But the farmer markets are really creating that connection and also, strengthening the capacity of the local farmers to make a living. If their product is purchased ahead of time. And this is something that in Brazil, really there's going to be a particular attention to and a big investment to connect the purchase and the supply to schools with the neighboring farming areas. Food offering in public institutions. Well, there is clearly a responsibility and a power the municipalities have to purchase the healthy foods. Victoria was telling me 80,000 meals per day are bought by the Milan municipality. That's an incredible power to not only provide the healthy food to the people that are catered by those institutions, children in school, employees working in canteens, people that are going to hospitals or health centers, but also a way to shape what is delivered to the cities. So, the same system, if that system is really providing healthy products, that same system will be facilitated and will become basically cheaper. Social support systems to facilitate access to healthy food. Several cities have the power, economic power, to match social support system and make the food accessible to lower economic groups. Infant feeding. That healthy diet starts from very early in life. And unfortunately, breastfeeding rates are too low in the world. We need to increase them. One way would be to provide adequate spaces for breastfeeding in cities, also accepting breastfeeding in public, and in general, having safe, affordable, and accessible childcare options, including adequate food in kindergartens. Restrict marketing of foods conducive to unhealthy diet. Often we feel this commercial pressure, and there are ways to limit the marketing, not only within schools, but around schools. Some schools are even sponsored by food companies. That's certainly something that is in the power of governments, including local governments, to change. Regulate street foods. As I said, street foods are an opportunity, but we need to have regulations, for example, for the food safety, but also for the nutritional quality. What type of fats, for example, is used in